Hi everybody, welcome to our WVS webinar on our introduction to our Avian Webinar Series, very kindly presented by Dr. Shashi, who will share his excellent knowledge on all things birds, and I will pass directly over to him now. Thank you.
Hello, good evening, welcome everyone. So whereas I'm presenting is like just my experience is my last 20 years experience with the avian patients, and this is like a series of different topics. So we are starting with the handling and transportation physical examination. It's a very basic one. Okay, as we going forward, we can talk more about the advanced lectures. Transportation and handling of the birds. When you see, when you get an injured bird, particularly because we all are vets, and then what we expect is like the rescuer or the owner bring the bird, they how they bring. It's like we have different experiences. So when it comes to the transportation should be, it's like the bird should be bringing well ventilated and then well covered uh, cage or container of a proper size. It's like you can't bring a small pigeon or a small sparrow in a big basket. Otherwise, it's like it creates more trauma to them. Also, the carrier or container should have the good bedding or the material or just a towel to perch on it or to grip on it. Even if the people use cardboard boxes, okay, and there is no grip at all inside, so the bird just keep moving inside the box and just banging around the box when they bring it on no vehicle or inside the auto or in the car. So also it should be the safe and secure cage when you bring the raptors or big birds. Uh, so the cage size should be as per the requirement of the species. Suppose if you bring a big kite or big raptor in a small basket, okay, when you close the lid of the basket, it will damage their tail feathers or wing feathers. So that's why it's very important to bring, the birds and proper size cages require as per their requirement. So when it comes to the handling while putting into the basket or while taking out from the basket in transportation, one thing we need to take care when they are pet birds, they are habitual to the owner, but not to the us with us. And when it comes the parrots, their beak is really hard and curved, so that's why we sometimes call them as hook bills. And when they bite really bad. So whenever you deal with the parrots, make sure you handle them with either with the Turkish towel or with the napkin of the proper size. So whenever they bite, they can bite to the towel, and then by the time you can grip over their head, because their beak is so strong, they use no to crack open the nuts, and then they use these beaks to picking holes in the trees to make their nest. Uh, or inside the cage, they use it for the climbing. So when it comes to the parrot testing, I said towel is the key. Now once the bird comes into the OT or a examination room or in a center, make sure before opening the box, the fan is switched off, the curtains are on the glass. Otherwise, once when you will try to open it and the bird escapes, then it straight either bangs on the windows because try to escape on the glasses, or just fly into the fan, and then you have the another issue to solve. So we open the basket, you put a towel in on the bird, secure the head first, and then gently hold the legs, and then you lift along with the towel. Once you lift in your hand, then you can have a good grip on the head and on the neck. So, and holding this legs. So hold the bird close to your body, okay, after securing the neck. So as you know, like birds have the complete trachea rings. Even if you secure the neck slightly tight, it will not hurt them or they will not suffocate. But if you hold tight on the chest, they will. When it comes to smaller parakeets, like budgies or bajrigas, or we generally call them lovebirds, though they are not the lovebirds, they are bajrigas. And because they're smaller size, it's very difficult to handle them. So again, if you have a small towel or a napkin kind of thing, you can just cover them and then hold it and lift it and then hold properly inside the towel and or the napkin. But if handler, if so examine the bird, you can have your index and middle finger around their necks from behind, and the palm resting on their back and securing their wings with your ring and little finger and thumb around the body. Every time, make sure that your grip is proper. If there is no proper grip, there are high chances they will bite. Also, at the same time, if you hold too tight on the chest, they may suffocate and die. When it comes to the parakeets restraining, so always, as I said, towel is the best. You can use towel to grip on the head and then secure the legs, and then you can adjust your grip as per your requirement, what thing you want to examine. So you examine the head and eyes and beak first, and then you can go slightly. You cover the head and beak, and then you examine the wing, the body, or the legs and tail feathers. So securing it properly is more important, as you can see in the pictures. Also, when you try to take out them from the cages, make sure that you don't pull them directly, because when they grip on the cages, they grip really well. You just remove one talons or nails from the cage, and then you hold them by securing the legs. But don't just pull them. So without a towel is a risky, but if like you properly give this three finger grip around the neck, and one finger is three fingers around the neck with the thumb, and then index finger on the top of the neck head, and the other hand supporting the body, covering like the primary feathers, tail, and then floor, legs. Make sure that the chest stays free. So when it comes to the medium birds, and if they are not biting like with their strong bills, particularly even including raptors, they usually don't bite, but their talons are really strong, and once they close the paw, it's like a mechanical action. It's not like voluntary. You see involuntary closing when they close they bring the sorry, when they flex the hop joint. So it's involuntary closing of the talons. So make sure when you hold them, as again for the raptors, you can use a towel and then putting the towel on their head, and then you grab the legs and then the head, and then you can have this bouquet kind of grip, uh, securing their both the legs without finger in middle, and all the primaries from the both the wings and base of the tail. For the pigeons also, in picture how you see is like just a kind of bouquet, you can hold them. So uh, the point here is always when you hold, it's not to hold on the chest, because they breathe by movement of the chest and not by the it's like uh, their lung, they don't inflate, they are fixed in the rib cage. So when they exhale or inhale, they need this chest movement. So you can restrain the legs, wings, and head, but not on the chest. 200 again grip for the pigeons or the medium sized birds, not the bird like 400, 500 grams. You can secure, but just with the two fingers, your thumbs are behind on the back, and then loose grip of your rest of 8 fingers around the body, so the bird can breathe easily. Okay, so if they struggles in any grip, when they struggle to fly, okay, for a fraction of second, you just tighten your grip, and once they give up, you loosen the grip. So that's the key when you handle the birds. So for the raptors, as I said, they usually don't bite. So it's always better, hold them in a bouquet grip and support the body with the other hand by holding the head. Sometimes if you want to examine. Otherwise, single hand grip is good even for up to 1.5 to 2 kg bird. So make sure you always put on one finger between two legs so their hocks can't rub against each other because the skin is very thin they can have the joint injuries very easily, and they need these leg movements for the hunting purpose. Again, you can hold the bird's primaries and feathers and then the tail. Also, when you're holding the bird, hold it close to the body so they can have the back support of your body and they feel secure. When it comes to the larger birds, like particularly like the big raptors, maybe the vultures or the big cranes, or uh, uh, when it comes to the handling them, again holding with the towel on the body and then securing the legs first and bringing them close to the body and holding the neck is the key. So you hold just base of the head from front, as you see in the picture, how uh, secured the legs in one hand and bird is close to the body, and all the wings, and both the wings are, one wing is close to the body, other wing is under the arm, and holding the hand on the neck. So larger cranes or when the birds are really big size, you can just wrap a towel around their body and then put it. At the same time, you can, if they're really long leg birds, then you need to put a one finger in between the tarsometer and then flex the legs so they can, it's like kick and damage themselves. Also, when you use the Turkish towel, make sure their talons don't entangle with the threads and they can damage the talons. So while releasing the bird, make sure the legs are free, then only you can release the bird. So table restraint is easy when the bird is wrapped inside the towel or cloth. You can just keep on the table and then you can uh, unwind the cloth around the body and see for the physical examination or for giving injection, whatever the required portion you can open slowly, securing the neck all the time. Because the cranes and the egrets or their tendency to pick at your eyes. So make sure you hold the neck all the time and cover the rest of the body of the bird and securing both the tail and primary feathers. And for examination, you can give one wing one by one and then the legs one by one and hold rest of the body on table. So make sure there's, like birds, you restrain properly without, harming them with any luxations or, the damage to the feathers. And as you know, it's like birds have, same unique personalities like human beings. So they are species specific. Maybe some birds just give up very immediately, even if you do the handling properly. Some die immediately in capture myopathy and in shock, while others can tolerate the handling repeatedly. If it comes to the exotic birds and they are hand-tamed birds, they are habitual to the human movement, human activity, but at the same time, they may not be, okay with some third person handling them instead of the owner or something. It's better when it comes to the owning own dog, own pet birds, exotic birds. Owner handles the bird and then you do the gentle examination. So the key is if they are under stress and like fluffing up or erecting the feathers on the head on the back. So make sure you cover them or you just blindfold them, and then you do the examination by putting the socks on the head or just closing the eyes or putting a visual barrier. It's very important. So when it comes to the what do you call this, like physical examination, remember one thing: whether it's exotic bed bird or wild bird, okay, certain things you need to keep in mind. First thing, if they are pet birds, definitely you will get the clear cut history. Uh, Always is not necessary. You'll get some of the history from the owner, and so if the owner just is keeping the pet with them and they are not attached with the pet, they may not understand, like the pet behavior. Or sometimes people send their pet along with their drivers or with their house helps, so these people may not able to give the complete history. So but still, you need to ask since when they are keeping the pet, and what is the age of the pet, then other birds or other pets at home, what type of diet they are giving, whether it's so commercial food or whether they are using is like mixed food like a commercial plus homemade food. Then what are the keeping conditions, the size of the cage, whether it's inside the balcony or it's inside the bedroom or it's just on the terrace or in the staircase. So these information helps to like diagnose probable what are the probable chances of the illness or the injury or the toxicities. When it comes to the wild bird, definitely the location of the rescue of the bird is very important. A rescuer can give certain kind of infection information, whether it's attacked by the predator or some kind of impact and a trauma, or it's like how they found the bird or how someone informed, or since how many days the bird was not able to fly properly and was flying short distance flight, and they were monitoring and then they got and then finally they got. So these information is very important to diagnose a particular condition or case. So when as I said, when it comes to the exotic patients, proper histories about the particular pet is very important. In that, its entire history may not be useful, but owner may provide some details which will be helpful to diagnose the particular case or condition. At the same time, you should know the species you're dealing. Then you know what are the high probabilities with that species getting certain diseases or certain conditions or certain behavioral changes. So what is important in case of exotic is like if the pet is not eating, then definitely there is some serious issue with that pet. At the same time, owner says the pet is eating but losing weight. So weight is the key when it comes to the exotic patients. They sometimes just a nibble on the food and not eating actually, and that way they drink a bit of water and they keep losing the weight and they become lightweight. So it's not always like history from the owner is useful. So you need to check the weight also. So when it comes to the basic differences of even patient and the mammals, so whatever the adaptation or the changes in the body in each and every system, they all are to adaptations for their requirement to fly for flight purpose. So most of the times to reduce the weight and as per their high maintenance requirement of high oxygen for the flight purpose when they really fly the long distance. So when it comes to integumentary system, the skin is more elastic and covered with the feathers, except on some part of head, and then the lower legs like shank and the toes, they are covered with the scales. The skin thickness in these areas is like 6 to 10 cell thickness thick, but when it comes to the feathered areas and covered skin, is the skin thickness is only 4 to 6 cell thickness layer. So that's why it's very thin, so difficult to suture. At the same time, though it's more elastic, so you can't stretch it. When you stretch it, Okay, it loses its capillary bed, and then it's more tend to, it's like a having this like ischemic necrosis because you disturb the capillary bed. So when it comes to the respiratory system, the as I said, the trachea are with the complete tracheal rings. Within the different species have different size of the trachea. In larger cranes and other flying species like pelicans, uh, when they are like above 4-5 kg, their oxygen demand is really high. So their trachea not goes straight away from the cervical region to the thoracic region. It goes inside the sternum sometimes, take a loop inside the sternum, and then come back and then enters the thoracic region. So these certain adaptations you see, then they don't have the diaphragm. So there is no clear-cut demarcation between thoracic and abdominal cavity. So that's why their abdominal cavity are called as a coelom cavity. So, and they have these around 9 to 11 air sacs which are connected to the lungs, and their lungs don't have the alveoli, they have the air capillaries. So this their lung is basically is a mesh of capillaries, so air can flow freely inside the lungs. And as in case of alveoli, it's like that is like a balloon, like a dead end pouch. So their air goes in and comes out. But in case of air capillaries, they have, it's like the air circulates through entire lungs. Also, the lungs, they are connected well with the air sacs. They have 9 to 11 air sacs, which are like two cervicocephalic, one clavicular, two cranial thoracic, two caudal thoracic, and two caudal abdominal. So all these air sacs are connected with the lungs, and they plays very important role when it comes to the respiration. At the same time, their bones are pneumatic, but not all the bones are pneumatic. Only when you see it's like a humerus and femur and the sternum, they are pneumatic, but there's bone like a tibia, fibula, and tibia particularly, and ulna, they are hemopoietic bone, as you see in mammals. When it comes to the urinary system, their kidneys have 3 divisions. So they are the divisions and not the lobes. Because what is the difference between division and lobe is like lobes have separate blood supply, but divisions they don't. It's the same blood supply. So, and the kidneys, they are embedded into the pelvic girdle. So, and is covered by 3 sides dorsally, and both the lateral sides are covered with the pelvic girdle. So there is no scope for the kidneys when inflammation happens, the swelling. So they will put swelling occurs only into the ventral side, where the other veins, other nerves and blood supply passes. So you may, if the bird with the kidney issue may come as an limping bird. So they are nothing to do with the injury. So, and the kidneys are like half mammalian and half reptilian types. The mammalian type kidneys, nephrons produce the urine, while the reptilian type produces the uric acid. Their end product of protein digestion is uric acid and not the urea. So that's why it's very important to know that uric acid is the marker for the protein metabolism and not the blood urea nitrogen. So continuing with the differences, digestive system, their they don't have the teeth. Their beak, bony beak is covered with the keratin, and is depending on their requirement, the beak shape and structure changes. They have salivary gland all over their mouth. Then they have this dilation of the cervical esophagus, which we call as a crop. Few species don't have the crop, like the owls and then when it comes to the gizzard, their stomach is two-part, like a glandular stomach, which is proventriculus, and then mechanical stomach is like a gizzard, which crush the tissues, with food with the wheat and strong muscular force. Their intestinal loops are fixed. They are in coil shape, and then it's like a mass at one place. While it comes to their the caudal portion of digestive is like coprodium, whereas rectum empties in coprodium. Is a part of cloaca. Cloaca is like again a part shares the uh, with the two systems called as an urinary system and then genital system. So when it comes to the circulatory system, their heart size is 1.5 to 2 times larger than the mammals. Suppose and birds can tolerate more blood loss, like a human can tolerate, up to 15%, 14 to 15% of total blood loss. But the birds can tolerate more than 30% of blood loss without dying. So this is because they have this unique portal system where they can shut down the supply of the blood from the muscles and the tissues to the into the circulation when they are having this blood loss. Also, at the same time, with the unique portal system, the blood from the lower body parts may not come to the heart directly, and it goes to the kidney directly and filters from there, and then removes the toxic material. So that's why it's not advised to inject the birds on the thigh muscle or lower body parts, because if you inject the drug there, then without coming into the metabolism and in circulation, the drug can get excreted to the kidneys and can damage to the kidneys. So when it comes to the nervous system, their brain is well developed, only the structures at different places as compared to the mammals, but they have very big optic nerves, which it's like if you compare together, it's like two optic nerves can be bigger than their spinal cord. So and their nervous system is like the feathers are really sensitive to the heat and cold. At the same time, plucking, as you say in case of small animals, the skin is more sensitive than the when you suture it. The same thing when you do the feather plucking, that is very painful process because they got their own nervous supply. When it comes to the musculoskeletal system, because to reduce the weight, they don't have as such subcut tissues or fat padding in between the muscles or on the body or inside. Only they got the fat padding inside the abdominal cavity when they are in breeding season. But the muscles are like just originate from the joint and they insert on some bone or again on joint without any subcut tissues. When it comes to skeletal system, most of their head is like the sinuses, and they have these scleral rings into their eyes. At the same time, they have like 11 to 25 number of cervical vertebrae. Their first few thoracic vertebrae, they are fused together and they call the notorium. And their few caudal vertebrae and lumbar vertebrae, they fuse together and we call it as a synsacrum. So, and their last bit is a coccygeal vertebra, they fuse together and form a quadruped structure, which serves as an insertion for the tail muscles. So this notorium and synsacrums, like first few thoracic vertebrae, then caudal in notorium, and then caudal thoracic, lumbar, and then sacral vertebrae, they form this synsacrum. So if you get a fracture in case of spinal fracture, then usually in between notorium and then synsacrum. They have this when it comes to the wings, they have humerus, which is pneumatic, radius, and ulna. Ulna is bigger in case of birds. radius is smaller, while in case of mammals, radius is bigger and then ulna is smaller. In case of bats, only radius is there and radius is bigger. So they have this only two carpus, radial and ulnar carpus. They are metacarpally fused, and then finally you have 3 digits. When it comes to the legs, they have this femur, which is again a pneumatic in some species. Then tibia is again hemipoietic bone normal, and then tarsometatarsals, and then digits of phalanges. So certain species have 3 digits, some have 4. So from you, when you count the digits, is like medial to lateral. So first medial is the first digit, and then second. So in case of parrots, if you see the first and fourth is medial, and then second and third is lateral digits. So the first and second first and fourth stays behind, and then second and third stays front. So like this, their sternum is like a keel shape, and they have this strong crest on it, on the keel bone, which is serves as insertion for the pectoral muscles, and this is the pectoral muscles are the site for the injections. So clavicle and is like a U-shaped bone which prevents the downward movement of the wings while they fly, and the sternum, sorry, not sternum, the coracoid gives stability to the sternum along with the scapula of the vertebral column. So there are the feathers on all over the body. As I said, it's like when and called, there are some non-feathered tracts which we call as an uptairly, and the skin thickness on feathered part of the body is like just 4 to cells layer thick. So certain species have extra structures on their bodies, like in case of lapwing, they have extra larger alula. In diving birds, they have this diverticulum inside their glottis, and which is, that's why difficult, certain species to put an endotracheal tube because of that diverticulum. In case of raptors and then parrots, they have this operculum in their nasal cavity, which breaks the turbulence of the air and warms the air and send inside the lungs. So that's why it's not some foreign object or something. If you pick at the operculum, it can bleed very heavily because it got really good blood supply. When it comes to the, now these are the differences of things. Still, I'll discuss about more differences in features next slides. But when it comes to the physical examination, when you see avian patient, these are the minimum basic things you need to notice. What is like a general body condition, temperature, respiration, heart rate, injuries, percent of dehydration, any discharge, ocular, nasal, or cloacal discharge, or choanal discharge. Then what is the color and texture of the fecal material, whether 3 portions are there or not. Most important thing is under how much stress the body is. So we'll see one by one. So body condition score is usually people score is 1 to 4. Some people score is 1 to 5. Some says like 1 to 10 also. 1 to 4 is ideal. When you score them, 4 is the good, 1 is the bad. Okay, so few people can give 2.5 or 3.5 or 3 or 4 also. So 4 is when the keel crest is not visible and the muscle layers, the pectoral muscles are slightly higher than the keel crest, and skills crest stage and depression. So that way you grade like how prominent the keel crest, and depending on that the score. The more the prominent keel crest, the lower the body score. General feather condition you can see is like whether there is a shine on the feathers, whether they are properly aligned with the body, or whether they are rough feathers, where the shape of the primaries, secondaries, and tail feathers, where they are damaged, not grown properly, or even the certain deformities due to the lack of nutrition or growth. These things decides, the fate of that particular bird. So when it comes to the normal keel crest, if you see on the left, the bird with the more prominent, the pectoral muscles and only white line, and even the barring and the color of the feathers are really good. While on the right side, you see the prominent keel crest with the more, the dehydrated or dark color muscles on the around the keel crest, and the feather color is also not prominent, though it's the same species. So when it comes to the temperature, uh, uh, it's not an ideal parameter to assess the condition of a bird, because most bird maintain body temperature between 101 to 109. Sometimes you can record up to 110, or just thermometer shows high body temperature, so it's like above 110. So depending on the species and the time of breeding, whether they are migratory species, it decides the body temperature. So again, depending on the season, even in the winter, the migratory species can show 108 degrees centigrade temperature, Fahrenheit temperature. So high temperature is not, that problematic but the low temperature, hypothermia, is like a concerning. Definitely high temperature in summer and the bird is really panting and about to collapse, then it's not a good sign. And they can be dehydrated very easily. But the low temperature, even with the ideal condition, is the one we should be careful. So transportation stress also can have the impact on the temperature. So whether it's in packed box without a ventilation, or it's a teen vehicle, or just if the bird is able to see everything around, not covered cage, definitely it will put the stress on the bird, and then temperature will go high. When they are sick and injured and fall without no activity, okay, and blood loss or hypoglycemia, they tend to lose the temperature very fast. So hypothermia is more concerning factor than the hypothermia when it comes to the birds. When it comes to the respiration, okay, ideal is when you observe a bird from a distance, you may not able to see the respiration. Okay, but if once you handle, then definitely you see the you can check the respiration with the thermometer, with the stethoscope. You can see from a distance respiration when they are panting or they are doing open mouth breathing. When they are doing open mouth breathing, either they are really anemic, or there is a constriction in their trachea, maybe due to the stenosis, or maybe it's a foreign body, whatever. So then only they do the open mouth breathing. Or when they are stressed and they are not able to breathe, they do open mouth breathing. So that's actually is like it's like serious issue when they do the open mouth breathing. After the open mouth breathing, if you handle them very quickly, they can just collapse. So when it comes to the respiration, as I said, they have this air sac and pneumatic bones. Along with that, their lungs are embedded into the rib cage, so they can't technically inflate or deflate their lungs. So it's a mesh of capillaries. And if you compare the lung surface area of a 1 kg bird and a 1 kg mammal, so 1 kg bird have larger breathing surface area, because the capillary size is just a 3 micron, and then if you see the alveoli, lung alveoli, they are 10 micron. So area wise, they have a larger breathing area as compared to the mammals. So when and the breathing, the respiration is like it's a complex process in case of birds, because they breathe twice in one breathing cycle. So when they inhale the first air, half of the air will go to the lung and half will go to the caudal air sacs. At the same time, the air from the lungs will go to the cranial air sacs to deoxygenated air to send it out. When they exhale, the half of the air from the lungs goes directly to the out, while half go to the cranial air sacs. And at the same time, the air from the caudal air sacs comes to the lungs. So it's that way they breathe twice in means oxygen exchange happen twice in one breathing cycle, and this can fulfill their high demand for the oxygen. If you because of pneumatic bones and air sacs, it's not ideal. It's like you the intraperitoneal fluids, or you can put intraosseous catheters in certain bones like a femur and then humerus, because they're pneumatic. You can drown the bird directly. Also, if air sacs are ruptured, they heal by their own inside. But if it's coming in the subcut, then definitely you need to cut open the skin and then let the air breathe out. And the air, once the air sac heals by their own slowly, it stops the air from leaking. So when, as I said, we may not able to see the respiration when they are awake or in the cage, unless and until they are doing the open mouth breathing and struggling to breathe. So under anesthesia, when we say it's like, it's like there is a critical condition, or they are comatose and you are monitoring the respiration. If respiration goes below 8, so like what is the ideal under anesthesia is like same as in mammals, like between 12 to 16, or some species like, it's like 10 to 24. So depending on that, what is the ideal? But if I'll be worrying if the respiration goes below 8 per minute, because that's really low for the that birds. So heart rate, when it comes to heart rate, when they are awake, it's really impossible to count the heart rate in smaller species. Like sometimes it's about 250 to 350. So you can't count them literally. So how you count is 1 to 3 4 like this. But it's very difficult to count and keep a track. But under anesthesia, when we say is like, what is the ideal or the heart rate is like anything above 80, 90 is good. And whether it's a respiration or heart rate under anesthesia, when we monitor, we not actually bothered about the count, we bothered about the pattern. So when we count every 5 minutes, and if they show the declining pattern, maybe the heart rate will be about 250, but it's continuous 4 respiration heart rate it counts, it shows declining, like from 250 to 230, then 210, then 190, then I'll be worried, because like a decreasing pattern. Same with the respiration. So when it comes to the critical condition, and heart rate is like below 40 is critical. But certain species, even like when they lose deep in anesthesia, lose a good quantity of blood, then it may be 35 or 38 is also ideal. But that you need to judge case to case. But as I said, like the pattern is more important when you monitor the anesthesia than the actual count. If you are giving bolus fluid, either it's IV or intraosseous or intravenous, if you push it too quickly or too fast, they can just collapse with the jaw. So that's one thing you should notice. Like the size is very small, though they have if you comparatively they are bigger size. But when it comes to circulation, there's large volume in the circulation. If you push too much fluid, they just collapse in shock. This is quite a big part when it comes to the injuries. So when you start the physical examination, there is like like a particular pattern. You start at the beak and you end on the toes. So you see the head first, okay, and any injuries or traumas. Then you open the mouth, you see the eyes and ears for the discharges or for the injuries, or okay, you see the feather then you see the oral mucosa, you see the strings of mucus inside the mouth, which can help you to uh, assess whether the bird is dehydrated or not. External injuries when it comes on the body, wings and legs, and their bleeding is very easy to recognize. But if you know, it's like when you see the injury, don't be excited and just okay, now I see the injury and this is the issue and close the case. No, you need to do thorough physical examination right from, as I said, from peak to the toes. So check everything: the neck for the minor injuries, the body, the sternum, the wing, then the other wing for the luxations or other smaller injuries, entanglement of the threads or the foreign bodies, then the legs, both the legs, and use palpate for the fractures. If there are no injuries or something, you easily miss the femur fractures if there is a long oblique fracture and then the fracture gets stuck together. Okay. Or it's a closed fracture and because of feathers you can't see the bruising or trauma in cases, then you can just easily miss the those cases, those things in first examination. So that's what to the legs. You can see the feathers for the injuries, for damage, any old injuries or matting of the feathers, then joint luxations and bones. You can develop a skill. You just palpate, start at the shoulder, roll your humerus, elbow, radius ulna, and then carpal joint, and then fuse metacarpal and the digits. The same way you can just, it's like keep the bird gently on the table, see whether it's bearing the weight or not. For feathers, you can make out externally that okay, there is if there is damage, but sometimes they cut keeping 3 or 4 primaries, they keep another 3 or 4 primaries. So you may not notice the cut feathers unless and until you open them. The important. Okay, so when it comes to the injuries, okay, the head injuries are really important because as I said, it's like you start from the beak and you finish on the toes. So you check for the any bruising on the head or the just a feather loss on the top of the head. Inside the oral cavity, you see the corner cleft. Inside the cleft, if you see the bleeding from there, it's definitely head trauma. You can see any puncture wounds inside the mouth. Then this is like a talon punctured wound on the head. So it's like because we checked it properly and then we saw this puncture because of territorial flight. Sometimes owner or the rescuers, they keep these patients at home and then they feed them the non-appropriate diet, and then when the bird gets sick, really sick, they bring to the rescue center. By that time it's too late. So that's why taking a history regarding the feeding or the rescue is very important. Crop fistulas also, it's like get unnoticed because you see only a small hole into the crop. The bird eats nicely, and but only part of the food comes out from the crop and then part goes in, and you see only the small matting on the feathers on the chest and may not realize it's actually a crop fistula or something. The injuries, the minor fractures of the beak or uh, as I said, like uh, traumas under the feathers is go unnoticed. So that's why it's very important you check each and everything thoroughly. So you start from the head and you finish on the toes. So now if you see this it's Egyptian vulture, if you see the tail position is pointing down while the wing feathers they are at proper place. So this was the case of it's like the fracture between synsacrum and notorium is minor fracture. And when the bird banged on the chest, okay, this bruising you see is like very greenish area, but that doesn't mean it's like a necrosed area or necrosed skin, because as I said, like birds they bruise green because they lack this biliverdin reductase, and which can convert biliverdin to bilirubin. So the green is the bruising. So at the same time, when they get injured and they bang on the head, there are high chances of head trauma also along with the fracture. So then you decide what to treat first, whether it's head trauma or fracture. So That's why it's very important you do the thorough physical examination. Another thing is like the burn injuries can go unnoticed very easily because they're very small burn injuries and put birds under shock. Now, in this case, if you left corner, if you see there is like very large burn injuries on both the hop joints. So such birds may not survive, and it's a major burn. But if it's a minor burn and the bird comes alive to you, there are high chances there you can treat and save them. The fractures, again, if they are bleeding, they definitely you can see very easily. But if it's closed fracture, then it's very difficult to say them from externally. Sometimes, the femur fracture, with oblique fracture, and the fracture ends stuck with each other by overriding, then bird may not show actual pain or maybe the partially bearing the weight on the leg. And these fractures can go unnoticed. So that's why it's very important, see, you get an wild bird and something is wrong, definitely you need to go for the x-rays if you're not see any external abnormality, because the bruising may stay inside this under the feathers and you may not notice it. So that's why it's very important. If you're not see any external abnormality, you check the x-rays so you can see sometimes like maybe the ascites, maybe the rupture of the air sacs, maybe the inflammation of the liver or lungs, or sometimes the lesions into the lungs area or the lesion into the air sac, maybe the fungal lesions, which we can spot. The definitive fractures you can see very easily. It's very difficult to diagnose the minor luxations in case of birds if you are not habitual to them. So palpation is the key. You start at the shoulder and finish on the wingtips. Same with the legs. You started at the hip and you finish on the toes. So you make this habit, and then only you can able to see the diagnose the minor luxations. When it comes to the infections conditions, okay, they are sometimes they are sick and may not be the injured, and they come with the sickness. So it's very important if they are without any injury or any fracture, and you do the thorough physical examination, you don't find anything. When it comes to the temperature, as I said, they don't show much difference in the temperature unless and until they are really stressed. They don't show the respiratory stress. Heart rate, again, is very difficult to, when they are awake, it's very difficult to count. So these basic parameters may not be helpful when it comes to infectious conditions, but the classic key lesions can help, like pox lesions you can see on the face or on non-feathered areas on the toes. RD and ND and the pox are very common in Indian conditions, or like they are contagious and they can spread very easily. But and the birds, they don't die like that easily with these infections. In case of RD, if they are not able to eat and drink, then normally they die in it's like emaciation, but not because of the disease. So if they are showing torticollis or not able to eat because of that, then only they die. These cetaceans, beak and feather disease is like very common contagious in viral infection. Again, it's like when they lose these feathers on the head and on the body, you can say it's maybe the viral infection. There is no way you can confirm, because even if with the samples you send to the laboratories, there are no such laboratories who can diagnose particular avian viral diseases apart from pox and RD, because they are very common in poultry. So the teaching institute or the poultry industries laboratories can treat this. But apart from that, other diseases is very difficult. Even influenza, another is like a very important disease. Even if it comes to the poultry or wildlife, you see these outbreaks in peacocks and in crows sometimes. But rest of the birds may just go asymptomatic. Definitely the water birds like ducks and geese, they also show this disease. They may be just asymptomatic carriers, and they spread this disease when they migrate. So when you see any outbreak in case of wild birds, or even if it's a domestic bird, you see the migration path of these birds, from which area they are migrating and which migratory pathways they are in. Infection, inclusion body hepatitis is very common. Again, it's like certain birds can die with this, and certain may just show the minor weakness, but they survive. Again, unless and until you do, it's like culture sensitive swab testing into the labs or something, is very difficult to diagnose this disease. Then another is PDD, is like proventricular dilation disease, pyelomovirus. That is also another viral, but again, it's very difficult to diagnose with the laboratory confirmation. So these are the viral diseases. When it comes to the bacterial, okay, mycoplasma, then gram-negative infections like salmonella or pseudomonas, they are really very common, but may not be showing the disease. Like a grassland birds are susceptible to these infections, but water birds are really resistant. So is when you house them, is very important. It's like house them depending on their categories or depending on their compatibility. So you will not spread the cross infections within this between the species. E. coli is, I feel, is like nowadays like more resistant microorganism, though it's very common bacteria and you found it everywhere. But whenever we send certain uh, samples for the testing, it comes always with the E. coli and a very resistant uh, strain, particularly with the most of the common routine use antibiotics. So the AMR, or it's like is a concern when it comes to the E. coli or certain infections, bacterial infections. In case of fungal infections, Aspergillus and candidiasis is like very common. You see these lesions in the mouth or sometimes inside the lung. Again, unless and until you see the lesions with the endoscopy, or it's like you send this tracheal flush or nasal flush for the testing, you may not able to diagnose or confirmatory diagnose. And again, these testings requires it's like the culture sensitivity requires more than 14-15 days or more than 21 days sometimes to grow the organism in the laboratory and then test for the sensitivity. And they are very specific drugs. So, and the treatment is quite difficult when they form these granulomas inside the lungs or in the sac. So again, it's like very limitation if they have these diseases, because it requires long-term nebulization and the treatment. I'm not sure whether the wild birds will handle that much handling and stress for the long duration of 2-3 months or more than that duration of the treatment. Parasites are really common. Unless and until the birds are sick, they don't flare up. When they go sick or the immunity goes low, the parasitic load flares up. Trichomoniasis is very common in pigeons and in raptors like kites and chikras or owls. So it's you see the oral lesions inside the mouth is like growth, and they respond very well with the metronidazole. And if you treat, but again, it's like a time being. If they share the same food and water locations, then they can get from each other. So immunity is the key when it comes to this infection. Ectoendoparasites are also common. So when they are in captivity or in the shell in the rehabilitation facility or in the clinic, they come. It's always better, it's like if they are not showing any abnormalities or anything, you don't suspect anything, just deworm them for ectoendoparasite. Uh, Certain diseases, no, it's like just the reactions to the uh, when it's the discharge, because as I said, the discharge in case of avian is a dry, their exudate is dry, so it doesn't flow out, so it just stays there. So, and it accumulates unless and until you remove it manually. So sometimes you just drain it by giving a stab incision uh, on the skin, or in like what you call is like ocular pouches, or ear pouches. So you just stab and you just drain them by squeezing them out. So this is again a classic tricho in the first. Then this is the pox lesions around non-feathered areas around the face, and this is again a trichome. And see, this is citizen's feather and wing disease case where the bird lose feathers on head and on the body, and then it's like there's a growth of the keratin on the beak. Ectoparasite, as I said, it's like ticks, and then flea. Ticks are common if you house them together, and then there is no proper cleaning and disinfection of the cages. Lice, they are very common in most of the species. That's why when they stop breeding under disease condition, or if they are not healthy, they stop breeding, and that's when the population of the lice and mites increases, and then you see the more number of parasites on the body when they are in captivity. So again, you can treat for them ectoendoparasites. This is another mange or scaly mite. Again, same thing. Under stress, they can develop these mites. You can treat them with ivermectin. So other conditions like maybe non-infectious or anything, but it's like the loss of feathers. So you see the bird lost all primary feathers in the wing. These are the blood feathers just growing. And then see this, even just the hairs can just entangle around the toes, and then tourniquet acts as a tourniquet, and then eventually even they become tight, and they embed into the skin and scales, and then the toes they fall off. So that's why looking for these things is very important. Pros, usually they use any kind of threads or nylon material, or sometimes cloth material for their nesting purpose, and then the chicks, they come as an strangulation uh, kind of embedment of the threads around the legs. So, and then they lose this control on the toes. So if you remove the this foreign material by cutting them with the yellow number B2 blade, and then these things may need it's like supportive treatment, and then maybe the ball bandaging for the toes function. If the joints are not fixed, then you can treat them properly. If the joints are already fixed, then it's very difficult to treat them. So you just cut these, and they start eating and walking nicely. If they are not walking or not able to control the toes, then you need a ball bandage or shoe bandage. Tumors are again, is like it's not that common, but you can see, if you see not many cases. Again, no, it's like the laboratory diagnosis. Even if you do FNSC, or you just remove the tumor and send for the diagnosis, it's very difficult to diagnose them. But if you remove them easily and they are from outside, and then they got really good success. I not come across so many tumors in wild birds actually. Foreign bodies is another thing. Okay, now this is happens when it comes to the pet birds. Most of the time, the birds, they just sucks or eats the feeding tube. So that's most commonly happen. It's like the parrot families like macaws or cockatiels, or Amazon parrots. So these, because they eat very voraciously, and when the owner tries to feed with the feeding tube, okay, they just engulf the tube. In this case, you see, the owner was feeding with the very small birds. So with the crickets, by poking them with the needle, and the bird ate the entire needle. Again, this is a feeding tube. And now this is not a foreign body, just a egg. You see abnormal swelling on the coelomic cavity of abdomen. You can just have X-ray and diagnose whether it's a egg or it's like a cloacal impaction. Sometimes it's like because of the pasty vent or the very sticky fecal matter, the feathers around the cloaca, they stick with each other, and once it dry, even if the bird wants to pass the fecal matter, they can't, because it's like a sealed cloacal opening. So in such cases, you can do a cloacal flush, or you can just rehydrate the cloaca by putting a little bit of warm saline inside of the cloaca, and then they pass the fecal matter. So edemas are very common if it's like there is damage to the major vein. Then you can have the lower limb edema or lower wing edema. Okay, by the time it starts it's like a contralateral blood supply to reabsorb the edema. If that gets infected, then they usually don't survive because like a high temperature and then very high load, they usually give up because of toxemia. This is again it's like the pox lesion on the toes. So you see this wet infected lesion on the joint. The their injuries they heal by two ways. Either they cut off the blood supply and it dries up and then it drops, or if it's like stays wet because of edema and get infected and then it necros and then it putrefies. So by the time bird stops the blood supply, if the toxin comes into circulation, they usually don't survive. But if it dries and fall off, they can manage almost like without a week. So when it comes to the dehydration, it's very important to stabilize the patient first and not go for the injuries or the cure the conditions first. So how you know the dehydration in case of birds? So in case of small animals, we see the skin tint and the skin taste when we pull the skin and release the skin. Like this in birds, we have certain markers like the third eyelid movement. Third eyelid is actually is closest from dorsolateral to the ventromedially. So how quick the movement of the third eyelid can decide the percent of dehydration. If it's a sluggish movement, then you can say that bird is dehydrated. And it's very quick, lightning fast, then you can say it's normal. Again, it's like a basilic vein or it's like cutaneous ulnar vein on the near the elbow joint. If you put a pressure, mild pressure on the basilic vein, and you leave the finger, you remove the finger. If you see the basilic vein filling up, then you can. It's like a second time, duration of 1 second, or you see the vein is filling up. Then you can say it's like a 5% dehydration. If you put a pressure and you remove the finger and you see the vein as it is, that means the bird is normal, it's not dehydrated. When you see the skin on the face or on the lower legs, on the scales and digits, if the skin is wrinkled, then definitely the bird is dehydrated. And if it's shiny and fresh, non-wrinkled, then you can say it's like they may not be dehydration or less than 5% dehydration. On the pectoral muscle also, you see when the muscle lose the water, okay, it reduces the body condition score. Also, it shows the it's like dry skin on the pectoral muscles. So you can say it's like bird is dehydrated. When you do the oral examination and you open the mouth and you see this mucus thread inside the mouth, right? Thick mucus threads. That means the bird is dehydrated. So these are kind of landmarks or the you can see and then you say whether the bird is dehydrated. But any bird, if it's like whether it's a pet or exotic, not eating and showing some signs of illness or wild bird comes in hand, that means something is terribly wrong with the bird. So what is the first thing is, because their requirement for the glucose is really high because of high BMR, so they go in hypoglycemia very quickly. So and dehydration. So rehydration and then pain management is the primary things you do when you deal with the avian patient. So when it comes to ocular nasal discharge, okay, I said the discharge either stays is intraorbital and supraorbital sinuses when it's around the eyes. So you drain them either through inside the eyelid or you just give a stab and then drain them out. If they are like the trauma, impact, and bleeding inside, sometimes they bleed from the nostril also, or blood accumulates inside the eyes because of impact. So the damage decides the fate of the birds. If it's like they are bleeding continuously through the cornal cleft or through the nasal, then it's very difficult. If there is a fracture in the cervical region, it's very difficult. or they die immediately, even if there is fracture in the neck region. So hypersalivation, if they are not able to hold the head up, okay, then they hypersalivate. As I said, pest event we discussed already. So it's like these discharges from the, whether it's ocular or nasal, whether it's unilateral, bilateral, whether it's hypersalivation, whether it's accumulation of the exudate around the eyes, or in, uh, uh, or the pest event because the accumulation of fecal matter inside the cloaca. Even if the cloaca is not emptying, the bird may not eat and drink. So thus you need to check if everything is normal. You check for the cloaca also. Stress. Now this is means all together at every stage the bird goes under stress. So you try to minimize stress everywhere, during handling, during transportation, on table while checking. So once you examine the head and you blindfold them by putting socks on their head. If you want to take the weight, you blindfold them. So whenever it's not needed to see their eyes and or the head, you just cover them so they can stay a little stress free. Inside the cage also, sometimes if they are cornering, then it's always better. Give them the visual barrier. Then the nocturnal birds like owls or bats, sometimes even though they are in the cage, you need to give them the visual barrier, and you cover the cage for the darkness so they will not stay under stress. Again, handling stress. If it's very difficult, the giving fluid or pain management repeatedly, say every 4 to 6 hours or every 8 hours. So you choose the treatment plan accordingly to avoid the stress on the bird. You can offer the food in initial few days on the water, but don't force feed or don't forcefully drench the water. So if you also, it's like when it comes to the cage rest, the temperature matters a lot. They need a warm and cozy cage condition. If it's very cold and because of non-movement, they can go into hypothermia and die in those conditions. So you judge case to case, and then depending on that, you decide what is the requirement of that particular patient. When it comes to the fecal matter, if you know how to read the fecal matter, you can diagnose the cases very easily. If you see the first fecal matter, it shows the white is uric acid, the brownish and the blackish is the fecal matter, and the rest side watery content is the urine stain. So this you can say is like this is partly digested bird blood, or the bird is not eating or eating very less, and maybe the internal trauma. But a bird is using is like a protein reserve from the muscle. The second is like bird is using the protein reserve because you can see the uric acid, but this greenish discharge is actually a gut content, not gut content, the stomach secretions from proventriculus, which comes as a green material and into the food. Sometimes it comes, if it comes mixed with everything, and it's like watery, then it may be the, it's like the infectious. This is exclusive white and is like uric acid, and then bit of urine around it. So bird is not eating at all, but at the same time is using the body protein for the digestion and metabolism. Now, if you see this, again the first one, you see the uric acid white, fecal matter, and slight yellowish tinge. So this yellowish tinge can give us like something is wrong with the liver. Okay. Another thing is like the bottom one you see is like whole mixed liquidy and fecal matter. So these kind of fecal matter they pass even in case of toxicities like organophosphate or like rodenticide toxicities. So like this kind of fecal matter. This is fluorescent green, you see, and the fecal matter and the uric acid, but it's covered with the fluorescent green. Fluorescent green they show, like in case of parasitic infection, parasites, and maybe there's sometimes fungal infections. Those are the keys. So you can look for the fecal examination and see whether it's a parasitic eggs, or you can send oral or nasal swabs or corneal swabs for the testing, or the fecal sample for the parasitic evaluation. So these things can give you a fair idea what kind of what is you are expecting from the fecal matter. So this is again only the, you see, it's like a part of the fecal matter, and then uric acid, and then the urine. So depending on the species, also fecal matter changes. It's like the grassland birds, they have the firm solid fecal mass and then a cap of uric acid, because they are mostly is like herbivorous. The carnivorous and piscivorous can have more uric acid portion and the less fecal matter and more urine. So depending on the species and their dietary habits, the fecal matter changes. So whatever procedure you do, weight is the key. You need to monitor the weight, even if it's a captivity or if it's pet bird, because if they are sick, they lose weight very quickly. So if it's a pet bird, you can advise at least owner to take weight every week, at least, if they're eating and everything is normal. If they are just nibbling and not eating actually, and they're losing the weight, owner may think, okay, the bird is eating, and when they bring this like very emaciated and weak bird, and they usually die. So that's why when it's a pet bird, monitoring the weight is the key. Even without going to the vet or checkup, they just monitor the weight and they can know the bird is eating and the same thing. When it comes to the wild birds, in the captivity, definitely they lose the weight. But once they start eating, they gain the weight. And if they gain more weight and they are not flying, then there is extra pressure on their legs and on their plantar surface of the paws. So they are more tend to the, it's like a bumble foot, because of extra weight on the legs, and the plantar surface doesn't get the rest which they get in the wild when they fly. Also, if the cage surface is not suitable, the perch size and the perch material is not suitable, then, and they are using same perch, then there is always same pressure points come in contact with the perch, and then there were high chances they will develop this bumble foot. Even the perch size is not proper, their own talons can pinch their toe, and they can have these open wounds, get infected, and again end up with the bumble foot. So weight is also very important to assess their general health condition. So the blood collection. So if you can't diagnose anything and you can't make out anything, you can collect the blood. When it comes to the quantity of blood you can collect almost 10% of their body weight. Sorry, 1%, 10% of their body weight and 1% of their blood volume. So it's like for 100-gram blood you can collect easily 1 ml, but it's ideal if you stay on lower side, like 0.78. Another thing with the difficulty when it comes to the blood collection, where from small bird it's very difficult to collect. If you collect from the jugular also, and they already lost the blood, and or they are anemic, and you collect, and if they develop this hematoma, they may die in shock. So you need to be really gentle, just a single poke, and then you hold the puncture site after the collection for a few seconds, and with a mild pressure until the blood clots, and then only you release. Otherwise, if the bird jerks while collecting the blood, then because the needle ball of the needle is a sharp, so it can cut the vein easily, and they can end up with a bigger hematoma, and they may die in shock. So if they are larger, then it's always better to collect from medial metatarsal vein. Here you see the last two images. This is medial metatarsal. You can easily identify, and it clots very efficiently here. They not form the hematoma. But in case of jugular, there are high chances to develop jugular edema. And you always choose the right jugular, because right is two-third time bigger than the left one. In case of pigeons, we use wing vein or ulnar basilic vein for the collection of blood. And the same time, the the same thing here also. If you know, it's like cut the puncture the vein 2-3 times, or you cut the vein with the edges of the needle, then they form the big large edema and hematoma, and then they can die in shock. So what you can assess from the blood, because we don't have the specific laboratories which can run the samples on very small samples. Only the private practitioners, they have like dry chemistry analyzers, or for hematology you need to use the manual methods with the Newberg chamber, and then only you can count the cells and see the cells. Again, the species wise there is too much variations inside in the cell size, shape, and then even it's like granulation also. So it's very difficult to recognize cells also unless you are doing it regularly. Pack cell volume, you can make out if it's like less than 15 or 25%, then you can go for blood transfusion. You can do the interspecies blood transfusion. That's too high, they may not survive. First transfusion you can do without a cross matching also with a different species. It's not an issue. But when it comes to the biochemistry, hematology is quite difficult because you have to do it manually in Newberg chamber, counting cells and everything. But you can make out with the hemoglobin. You can check the hemoglobin, which may not be again correct because of hemo concentration or because of the portal shunt, when they can stop the blood into the circulation when they feel threatened due to lose more blood. So it may not always give like the clear cut diagnosis with the when it comes to hematology, even the black cell volume. So you need to give some time for the blood to settle, and then once it's settled, then you can collect and check the hematological parameters. When it comes to go to biochemistry, okay, then definitely AST is, as in case of small animals, AST is not a good marker for the liver function. Instead, that GLDH or GDH can be a good marker. But when you come to the kidney function, one is not useful, as I said, because their end protein metabolism and product is uric acid. So to assess that creatine kinase, you see the creatine kinase and AST together and you compare. So if his AST is elevated, not necessarily the means there may be chances of hepatocellular damage, but not necessarily the kidney. If AST and CK is elevated, then you can say both the liver and kidney may affected. But only CK is elevated and AST is normal. Okay, then you can say it's like only kidney is affected, and only AST is elevated sometimes, and then you can say it's like then the muscle damage is there. So like that, all markers are not ideal for unless and until you compare with each other. Again, when it comes to assessing the maybe the cholesterol or other enzymes or just protein fractions like a total protein or albumin globulin, you may not, there is too wide range to assess whether it's a normal or abnormal because of a very small number of samples we test, and this very difficult to interpret. I did a few sample collection and testing, and then extreme cases and the healthy cases, still I didn't find much difference in those parameters with the same machine and same method. So it's tricky how you interpret the results with the case and what is the bird is showing. And thank you.
Okay, thank you very, very much. We've got one last comment that's just requesting for this video to be, the recording to be uploaded, and anyone that's accessed this recording currently now live, you will have access to look back on it afterwards as well if you follow the same link that you clicked in the first place. But thank you so much, Dr. Shashi, for such good information and such a broad range of topics in that first introductory lecture. We do have 4 more lectures coming up. So we have one on anesthesia and analgesia, we have one on soft tissue surgery, and we have one on orthopedic surgery. And then our final one is on post-operative care. So if you enjoyed this one and or you think of any questions in the meantime, then we'll be doing more of these with Dr. Shashi. So everything bird related we will cover, and really hope you enjoyed yourself. So thank you. And thank you to Dr. Shashi.